Hey everyone, Ross Marchand here, Vice President of Policy with the Taxpayers Protection Alliance, and joining us today to talk about free trade, healthcare innovation, Buy American provisions, and the intersection thereof is NTU's very own Bryan Riley. So Bryan, first of all, welcome, and thanks for taking the time to chat. And there is so much in the news lately about Buy American provisions and the idea of a domestic preference in federal contracting. So why don't we begin by discussing that? What happens if the federal government, a federal agency is trying to procure something? What is the issue and where can they go and where are they not allowed to go to procure items?
Well, first of all, thanks for having me on. And Buy American, there are two different laws and sets of rules. One's called Buy American, one's called Buy America, and they're all designed to encourage or to require federal agencies to use U.S. Inputs when they're in their operation. Now, in most cases, there are some exemptions that say, well, when possible, you must buy American. But if there's a big price differential, you will have the opportunity to buy from another country, or in certain instances, the requirements will apply to federal agencies, but not to subcontractors. So it's one of those situations where the devil is in the details. It's more complicated than just a mandate that the government must only buy American-made products, but we're clearly moving in that direction, at least in terms of rhetoric, where the Trump administration has passed Buy American executive orders, is considering new ones that would really try and tighten it down and make it more of a requirement for federal agencies to buy American. But it's when you get really into the details on the exemptions and the processes, like anything, it can get pretty complicated. I think the bottom line, for groups like yours and mine that represent taxpayers, President Eisenhower observed with respect to Buy American preferences, he said it's, quote, it's improper policy, unbusinesslike procedure, and unfair to the taxpayer for the government to pay a premium on its purchases through these Buy America policies. It's an idea that sounds good on the surface, but of course, it makes things more expensive for the government. If we require you to pay more than you have to use a local domestic provider, well, there's a direct cost to that, and it's taxpayers that wind up paying the cost. There are indirect costs as well. But in general, their policies have been in place, really. Legislation's been in place since the 1930s. So there are laws that have been on the books for a long time. And something that I think is going to really continue to be a hot button going into the next presidential election.
Right, so you have these FDR era policies that are really just falling on taxpayers and customers. But now you're hearing increasingly, as you said, rhetoric and indications that the Trump administration and some lawmakers are considering double down, maybe expanding Buy American provisions, domestic preference provisions for contracting officers, especially pertaining to healthcare supplies. And obviously the healthcare supply bid is a huge deal given everything we're dealing with the pandemic and responses and complications related to the coronavirus. So can you go into a little bit of detail about that and explain what may change and what may stay the same?
Right. Well, we just had hearings here in D.C. where several lawmakers pressed our U.S. Trade Representative, Robert Lighthizer, on why we continue to impose tariffs on goods that we need to respond to the pandemic. So it doesn't make much sense to me for us at the federal government level to make medical supplies more expensive and less prevalent. We should be trying to do the opposite. There's a lot of, I think, misinformation going around related to the COVID-19 pandemic. And one of the, I believe, myths that's being pushed is that we're overly reliant on foreign countries for our medical supplies, including our drugs and pharmaceutical products. And Peter Navarro, who's the president's trade and manufacturing advisor, has been working on a Buy America provision just dealing with medical goods that would, again, we haven't seen the text of it, but reportedly would require the government to only buy US-made medical goods and pharmaceutical goods to try and encourage production here in the United States. And the ironic thing is, or the unfortunate thing, I think, is that many people don't know, we already make most of our drugs in the US. We already make most of our medical supplies in the US. And our imports mostly come from our allies. Just to throw out one example, we make N95 masks in the United States, but we make those masks with wood pulp that we import from Canada, and we use those masks here, we export them to other countries. So those are the kinds of back and forth across border supply chains I think benefit us, and would be a big mistake to try and crack down and say we're only going to require the use of domestic products. It would be costly and would really potentially make it harder for us to respond to a future pandemic or medical crisis.
Absolutely right. And notwithstanding claims to the contrary, we rely very heavily on countries like Canada and European countries who we have very well-established ties with, especially in the trade arena. Now, how do we strengthen those ties and ensure continued free markets, free trade in healthcare, and ensure that continued healthcare innovation instead of going in the other direction towards protectionism?
Right. Well, that's the key question. We actually released a letter from about 270 economists a month or so ago, including Nobel laureates, economists who'd advised presidents from Reagan to Obama, and worked at institutions from Harvard to Hillsdale, a really broad cross-section of economists who were concerned that Buy American policies in medical goods would be the wrong response. There are other things we can do to prepare. Domestically, there have been suggestions that we could improve our stockpiles of goods so that if there's an immediate disruption in supplies, we have the stockpile to really take care of our needs. But one of the things we saw during the pandemic was countries, not just other countries, but even here in the United States, started to not only clamp down on imports of certain goods, but also they did restrict exports of goods that they wanted to use. In other words, didn't want to have valuable medical supplies that could be used domestically, didn't want to see those being sold to other countries. And as a result, it just was a mess. At the end of the day, we wound up getting around a lot of those kinds of restrictions. But one thing that would really be proactive, in my opinion, would be instead of imposing new restrictions, let's work with our allies and our friends around the world to try and have a system that says, all right, look, in the future, we're not going to erect those kinds of barriers. We're all on the same boat. We're going to do what we can to help make sure the world can respond to a future crisis like this. And a lot of these efforts to restrict imports or to put Buy American mandates either on private citizens and businesses or on federal agencies are aimed at China, but more often they hit our allies and they hit our trading partners. And one of the things that are, going back to this economist letter, one of the risks that they identified was that when we start putting Buy American mandates on drugs and medical goods coming into our country, other countries are likely to put similar restrictions on US exports. And last year we exported about $80 billion worth of medical goods. So it would be costly if those exports were to be interrupted as a unintended but likely consequence of these kinds of mandates.
Right, absolutely. And there's so much information to take into account. And I feel like normally our role in exporting gets neglected at the expense of certain very narrow and misleading claims about, for example, importing from China. It's very unfortunate that this debate has gotten out of control in a way that does a disservice to the facts. But if interested people, they want to learn more, where can they go to read commentary by yourself and by NTU on this critical issue?
Well, we'd welcome anybody to go to our website, ntu.org. That economist letter that I mentioned is on our website. Also, some reports that I've produced looking at the amount of medical goods that we produce here as opposed to importing. Other statistics. I just want to throw this out. I should have mentioned it at the start. We have, according to the Department of Labor, about 300,000 Americans who work directly in pharmaceutical manufacturing. And a lot of people have this idea that we don't make anything in the United States anymore. Well, we do. Until this crisis hit, manufacturing output was near an all-time high. And certainly with respect to pharmaceutical and medical products and advanced products, the U.S. Was in the lead, and hopefully as we rebound and come out of this crisis, that will continue. These kinds of barriers just make it harder for us to emerge from that crisis. And again, you can look at our website, ntu.org, to get some more details. It's something that is, I think, really important. A lot of politicians at a superficial level either want to blame other countries for problems that a lot of times are created here in Washington, D.C., or use China, which, look, no doubt, they did a lot of terrible things that cost lives around the world. But let's not have a knee-jerk reaction that makes things even worse. So that's why I think this is such an important issue.
Absolutely. And blame and misinformation is a dime a dozen. But thanks for taking the time to talk about this issue, shed some light, and counter those myths with reality. Thanks, Bryan.
Thank you.